Welcome back to Subcut, the medical-ish podcast where we get under the skin of things that might be interesting to you if you're a high schooler, a medical student, a doctor, or just anyone interested in the healthcare pathway. My name is Justin. I used to be a doctor.
My name is Neil. I'm a fourth year medical student.
My name is Emma. I'm a third year physiotherapy student.
And today we are interviewing a special guest, and we'll flick to the interview soon, and we'll input our reactions and commentaries and any additional little points that we think are relevant. But we'll just jump straight into it. We're talking to Liz or Elizabeth Berryman from Chnnl, who's a doctor, a mother, was a nurse, has a bunch of roles in New Zealand. If you search for her name on Google, I'm sure you'll find one or two campaigns that she's led. Incredible person. So let's just dive into the interview and see what she has to say. Okay, so we're joined by Elizabeth Berryman, who I'll let you introduce yourself properly in a bit, but your journey is a little bit, I guess, in a way atypical, and that's the reason why I want to talk to you and discuss with you about it. But long story short, condensed, it's you started off as a nurse, and then you moved through to medicine. You're a doctor now, and you also have a new thing that you started on top of that, looking at more public health and mental health in the digital space on top of that. So there's a lot of things that we can talk about here, and I think it'll be a really interesting perspective to get into. So thanks for coming on to the show, first of all.
Thanks for having me.
So let's just jump into it. Let's just jump into the first thing. Let's just start all the way back from when you were because before you were a nurse, you were just a fresh high school graduate.
Yeah.
So what was your mind space at that time when you were leaving high school, thinking about what you're gonna go into?
Yeah, sure. So when I was 8 years of age, I grew up on a farm, and my uncle said, "Oh, I'm gonna go and have some home kill with the sheep." And so I said, "Oh, I want to come." And he goes, "Oh, that's a bit strange for an 8-year-old." But he took me along, and I was absolutely fascinated with the offal. So all the guts that came out of the sheep. And he said, "That's very strange for an 8-year-old to want to go and prod the heart and ask questions about the stomach and how it all worked." And he goes, "This kid's interested in science."
It could your life really could have taken a really dark turn, in another. That's like the beginning of a serial killer.
Story, yeah. But no, and so ever since then, I was really interested in animal husbandry and looking after things on the farm, and that got me really interested in helping people from a medical perspective and with health conditions. So I really wanted to be a doctor. And I would tell everybody, and I went through high school, and I was setting myself up to go to medical school. And then, fortunately, my boyfriend at the time actually got a brain tumor.
Oh.
And he sadly passed away of cancer.
Wow.
Yeah, so that was when I was 17 in my final year of high school.
Wow.
And as you can imagine, my grades took a huge dive during that time. And I decided that, in fact, I would go to nursing school instead. And I actually got a scholarship to go to AUT. So then I was like, oh, it's kind of sorted then.
Yeah.
I'll go to AUT and I'll study nursing.
Let's pause there. So when you decided to do nursing, was that kind of, you were sort of thinking that you would eventually go back into medicine after that? Or was that sort of thinking, okay, it's still along the lines of helping people in that medical capacity?
Yeah, it was still along the lines of helping people, and it aligned with my values and my vision of helping as many people as I possibly could.
Yeah.
So that's why nursing was a great option.
And I'm sure we're going to go into this in another episode where we really talk about nursing properly. But I mean, I think one of the things that a lot of, especially younger students, don't know is that nursing does have a wide variety of career paths and diversifications, and the journey through it can be quite long as well. A lot of different types of nurses and lots of further training and things.
Absolutely.
So I think a lot of people don't know that. They sort of think of a nurse and they only think of the person at that bedside who is,
or the hospital nurse.
Just the hospital nurse,
yeah.
or maybe the GP clinic nurse or something. But there's a lot of different levels. So anyway, we'll talk about that in a little bit more depth in another episode. We'll get more into nursing as a career. But okay, so you went into nursing. And then what was the thought process or journey from there?
Yeah, so I started nursing at 18, and so I graduated age 20, and I went straight into emergency department at North Shore Hospital, which is great, and I did my new graduate year there, and I absolutely loved it. I loved ED, I loved just the high stakes, I think, in ED. I love working in resus. In particular, and on triage. So yeah, I enjoyed my nursing, and then I went to the outback of Australia.
When was this?
So after my first year of nursing. So
After first year of nursing?
Yeah, so I was 21.
Yeah.
So still quite young.
Yeah.
And yeah, so I went into a place called Roebourne, which is Western Australia, and there was no doctors inside. It was me, the registered nurse, and a healthcare assistant.
This is emergency, like rural.
Yeah. I had an 8-bed hospital. Yeah, and it was mostly a mining town, and it also had a large Indigenous population as well. Yeah.
Okay. How long were you there for?
So I was only there for 12 weeks, but it was one of the best experiences of my life.
Okay, so let's fast forward now, coming back from that.
Yeah.
Because that would have been obviously it was a memorable experience for you. Did that change things for you after doing that? Where was the kind of... Because how long did you do nursing for actually?
5 years.
5 years. So you were in it for a lot longer than that. So what happened after that in the coming years to eventually move you back into medicine?
Yeah, sure. So that was when I decided that I actually really did want to be a doctor. Yeah. So I was in the outback, and if you had a patient who came in, you'd do your assessment, you'd ring the rural doctor in Perth Hospital, you'd talk through the patient that you had in front of you, and sometimes we'd do telehealth, so we would turn on the video and we would do the consult with the doctor in Perth as well. Then I'd fax through the prescription, they'd sign it off or do a standing order, and then they'd fax it back and I'd sort the patient. And so that was my first introduction to digital health as well, which is good. But I actually really liked the diagnosing part of it and the prescribing. And I was always asking more and more questions and why did you do that for that patient? And really wanted just to be able to do the whole lot for my patients. So that's when I was like, okay, I want to go to medical school.
And that's kind of one of the key differences between nurses and doctors, right? Is that as a nurse, any nurse can ask the why does it happen that way, or, therefore what can we do about it? But there is sort of a power limitation in terms of what that knowledge allows you to then do. Even if you know what it is or why or what to do about it, you can't really actually do it because you need the sign off or the authority.
Yeah, it wasn't so much like that because I went on and actually became a nurse practitioner where I did get to do the diagnosing and prescribing. I think it was the knowledge behind it. It was like in nursing, we only had a certain level. I wanted to go deeper. I wanted to know why they were making the decisions that they were making. I wanted to actually know the science of it and the full picture, which I think sometimes in nursing we jumped over a bit. So yeah, I wanted a deeper knowledge.
Okay, so tell me about being a nurse practitioner. What does that mean?
Yeah. So just to backtrack, so then I tried to get into medical school and they said, well, we don't take your nursing grades.
Right.
And they said, we suggest that you do some other study, a postgraduate study, and use those grades to get into medical school.
Now, is that because you did your nursing at AUT, or is it because it'd been a few years since you'd graduated?
No, it hadn't been a few years. So I think there is some stigma around the polytechs and AUT. Yeah. Right. Because if I had done nursing at Auckland Uni, they would have
counted it. Yeah.
Yeah. And they said because you can't calculate a GPA on those polytech grades when you can calculate a GPA on your Auckland Uni grades.
Right.
Yeah.
Okay.
So that was unfortunate. But anyway, so they said do some postgraduate study. So I did my master's in health science with a nurse practitioner.
Right.
And I did that at AUT.
Oh, okay.
Just to get to them. Anyway.
Yeah.
And yeah, I loved it. I loved doing my master's. Yeah, it was really great.
And you ended up actually going to medical school in Otago.
I did.
Yeah. So okay, let's go back to the nurse practitioner thing because a lot of people won't know what that means or what it involves. So just talk me through what it is first of all.
Sure. So a nurse practitioner is an advanced nurse. So you usually have a scope of practice. You can have like a child health scope of practice, or you could have, so for instance, I had sexual health scope of practice, and now they've actually opened it up so you can actually have a general scope of practice as well. But usually you would work in one particular area as an advanced nurse, and basically you can be the same as like a registrar level as a doctor.
So what does that mean if we really break down the difference?
Do you have prescribing rights? Yeah. So you have designated prescribers, which some nurses are designated prescribers, and they're not nurse practitioners. Nurse practitioners mean that they have the full rights to prescribe, or diagnose and prescribe.
Yeah. And can they prescribe anything that they want?
Within their scope of practice.
Right. And that scope of practice is very department, or rather, whatever they're working in, specialty specific.
Yeah. But say if you're a general practice nurse practitioner, the scope is very wide. There's, pretty much no limit to what you can prescribe.
So then what was the difference then between being a nurse practitioner versus being a doctor?
Yeah. I think because I'd already made that decision, I wanted to be a doctor. I just wanted to keep pursuing that. But yeah, I think there's still a ceiling for nurses. I worked with one in my first year of doctoring, actually, at Waitakere Hospital.
Nurse practitioner.
A nurse practitioner in gerontology. Absolutely incredible. But she was still very frustrated because she wasn't the same as a consultant. She wasn't an SMO. She was still at a registrar level, even though she was very much capable of being at a consultant level.
In terms of, so when we think about where the frustration's coming from, that ceiling, is that a knowledge ceiling, a authority ceiling?
An authority ceiling.
Authority ceiling, yeah. Now, obviously, I've worked with nurse practitioners as well, and often it's just like as a first-year house officer, especially if you're in a new run, that nurse practitioner just knows everything. They're your main go-to person because sometimes they're a lot friendlier than the registrars can be as well. That's senior to you. So, so you were a nurse practitioner. How long did you do that for?
So you have to do an internship, and there was nobody willing to take me for an internship. So there was a kind GP at Windsor Medical Centre on the North Shore, and he said, I'll take you for your internship, but I need a practice manager.
Right.
So can you please do both?
So a practice manager is, in a nutshell, is exactly what it sounds like. There's a medical practice, and they're the person that really manages the operations of that practice, and usually also is able to do that with the healthcare background and knowledge, not just like running a business unit. It
was still very businessy,
but it is very businessy. Yeah,
I was really
it's
surprised doing all the funding models, and also we worked out how we could increase revenue because actually it's quite hard to make money in general practice. And so because it was mostly an Asian population clinic, we did immigration medicals and things like that. So I made some business cases and presented them, which I never thought I would be doing. But now I realise that was all leading to me doing what I do now.
Yeah, which we're going to get to really soon.
Yeah.
Okay, so we have you then doing practice managering as well as being doing your internship for a nurse practitioner.
Yeah.
That internship was
1 year.
1 year. Okay. And then after that,
I then got into medical school.
Okay. All right.
Yeah. So I finished my internship and then went straight to Otago.
Right. So one of the questions that we get asked a lot is about going into medicine when you're already in your maybe mid-20s or something, and then they're thinking, when I graduate, I'm going to be in my late 20s or early 30s or something like that, or even, late 30s, going into medical school when you're already 30. What would be your thoughts around the idea of going into medical school a few years later?
Yeah, so I think we had the oldest person in my cohort, and he was 42. Yeah.
There you go.
So it's not too late.
Yeah.
And he, I think he was a senior lecturer in genetics. Amazing. And absolutely fitted in with the class, and no one batted an eyelid that he was actually a lot older than us. Yeah, it was fine.
Yeah, so it's fine, right?
Yeah.
Yeah, it's just fine.
It is. And there was like a whole, I don't know what the Auckland Uni was like, but in Otago, they've got a special entry called the other category. And so that's for people who have worked for 5 years or more in something previously to going into medical school. And usually they weight it towards the allied health, so midwives, paramedics, nurses. And so that other category, we kind of stick together pretty close. There's like 25 of us. And
Yeah, and if it's anything like the same as just postgraduate, I'm going to guess that other category actually has some real advantages over the undergrads when it comes to actually just going through the medical study and just being good at the whole experience of medical school and learning and being a doctor. Is that kind of the case as well for this?
Yeah, but we both bring our strengths, like, I know this is terrible, but we used to call them the kids, which is the young ones straight from high school entry. So the kids would bring their strengths, like we really loved getting to know them and seeing what they would bring, and they were usually insanely intelligent. And then they called us the dinosaurs, and we used to sit in Jurassic Park together in the lecture theatre. So it went both ways. So as dinosaurs, we would bring, life experience and, I think a lot of times people come to me with their relationship problems and all sorts of things. So you kind of, became the older ones in the group, and we had a great community. And I think it was really neat that we had that range of ages.
Yeah, and I think a lot of, if you're a student that's currently, gearing up to be one of the kids, that you're 16, 17, whatever, you're going into the pre-medical year, you're looking at trying to get into medical school the first time, maybe it doesn't go so well. I mean, at the end of the day, fast forward 10, 20 years down the line, I mean, how much difference does that really make, adding on a few more years? I mean, experience is experience, life is life. It's going to be, it could be, and has been, I think, for a lot of my previous students, they've said it's the best thing that's ever happened to them not getting into medical school the first time around because of the level of experience that
Absolutely.
It gave them.
I would actually agree with that.
Yeah.
If I went from high school into medical school, I don't think I would have the life experience to appreciate the great privilege it was to go to medical school.
I went in from high school. I didn't have the life experience to appreciate. I mean, it's just true. I honestly believe that it's true. I think something like a cadaver lab, if I did a cadaver lab today, I would find it so much more valuable, and I would appreciate the opportunity so much more than when I was a 18, 19-year-old second year medical student. And it's you're almost in a way blind to the privilege that you have because it's just part of the course, and then you earn your way into the course. But yeah, it's really not the case.
Absolutely.
Okay, let's get back into the journey. So you're into medical school at that point, and then that's 5 years further of medical school that you're doing it. Did you take
6
any?
years.
So you entered in, did you?
Although the other category existed, because again, they didn't like the fact that we went to a polytech, they made a lot of us others go and do the first year health science again.
Okay.
And we had to get a B average
Right.
to be able to get into medical school.
Okay.
So it was a 6-year journey for us.
Yeah. Okay. So then 6 years later, so you're going through medical school. Okay.
And just on that,
Yeah.
it took me 5 attempts to get into medical school.
Persistence is key.
I really, really wanted it.
Yeah.
I really wanted it. Yeah.
Okay. So 5 attempts. So 5 attempts later, 6 years after that, you have finished medical school. Let's pause there before you've just started working. You and your mindset and your thoughts on medicine at that time, how was that different by the time you'd finished medical school compared to at the very beginning when you'd just come in?
So I did a lot of leadership things during my time at medical school. When I was second year, they decided to change the student loans. Good old Stephen Joyce.
I remember this.
Yeah, you remember this.
That's actually when I think I may have actually met you then for the very first time at the New Zealand Medical Association Student Association conference in Auckland.
Yes.
You attended that, right?
Yeah, I did.
I actually remembered randomly recently when I was talking to Jess from Chnnl that I actually met you in the pool at the Langham Hotel that we're staying at. Yeah. It was between like a dinner event or something.
Okay.
And then I was like, oh, you're one of the conference attendees. And that's actually where I had first met you.
Okay.
And then I met you again through like your advocacy work and all of that sort of stuff that you became a lot more well known for. But anyway.
So what happened was when they changed the student loan system, they made it that you could only get 7 years of student loan. And as you can tell, I've done nursing degree 3 years, then I did my postgraduate diploma, another 2 years, then my master's, another 2 years, and then I did some research, so that was up to like 6 years already before I even got to medical school. And then I was looking down the barrel of another 6 years.
Yeah.
And so I was out. I was out of student loan, and a lot of my other category friends were also out of student loan. And so I took it upon myself to go and knock on Parliament and say, hey, can you make an exemption for medical students and for long degrees, such as dentistry and vets as well.
And actually the entire Medical Students Association had a huge push for that, a massive campaign that we, in fact, there was the petition, I remember, I can't remember which website it was on, but it generated something crazy. I can't remember the number,
like
but
25,000 people.
Within like 2 days or something like that. It was crazy, yeah. So that was a huge success. And actually it So we won, right?
Yeah.
And it did get
Yep.
overturned.
Yep. So went over Stephen Joyce and went to John Key and Bill English. Went straight to the top and said, hey, can you help us out? And so, that was really interesting, navigating that political landscape. And I really enjoyed doing that, and that surprised me. And then it came up that there was a Otago Medical Students Association president role, and usually it went to one of the kids.
Yeah.
Okay, sorry, I shouldn't say that. I thought, oh, actually, no, it's time for a change. Let's see if one of the old dinosaurs can run it. And so I threw my name in the hat, and they voted me in, and I was the Otago president. So that was my third year.
Third year, okay. Any other leadership things in third year?
Oh, lots. But
Okay.
Yeah.
That was the main one?
That was the main one.
All right.
Yeah.
Fourth year, what were the other things?
So then it
since
was
that?
about the end of third year that my husband said to me, he goes, I don't think you're going to be a doctor, Liz. And I was like, whatever. This is my dream. Like, have you not seen how hard I have worked to get to this place? Like, it's been my absolute passion. And he goes, no, I think you're going to do something else. You probably do something health related, but you're going to do something else. And so that's what sparked off something in my head at fourth year.
Mm-hmm.
And then I started getting involved in digital health as well, and health technology. So that's when I joined HINZ, which is Health Informatics New Zealand, which is a fantastic organisation, and managed to do a collaboration with the New Zealand Medical Students Association and with HINZ. I got involved in a lot of different things that wasn't core medical curriculum.
And by the time you were graduating medical school, you had a lot of experience in things that a typical medical student probably wouldn't have had experience in.
Yeah.
You're now working as a first year house officer, and that's always a big jump for most people. How did you find that experience?
So there's a little bit of that puzzle that I have to skip there.
Yep.
And that is that I actually ended up getting pregnant in my final year of medical school. And so I finished my final exam, which is a radiology exam, on the Friday, and then I actually had the baby on the Monday. So didn't really leave much gap at all between medical school and having the baby.
Okay, so let's talk about that a little bit more, because a lot of young women are having that concern or that question. What do I want to, if I want to start a family, how does that work? You know, all those questions around that.
And all my nursing friends, they were all having kids and having, their families and things like that. And here I was down in Otago, just doing my medical school.
So what is that like? I mean, how is it as complicated and as bad as it might seem to be?
No,
or?
so they have a medical parents group in Otago Uni, which is great. And like there was probably a one baby a year in my class. Yeah.
So it's really common.
Yeah, and they just bring the baby along to tutorials and along to lectures, and during school holidays, the kids would just play at the back of the lecture theatre. Yeah, it was very inclusive, actually.
So a common question that I'll often get asked is, do I have to wait till I graduate to get married? Do I have to wait till I graduate to, is there that perfect window before you become a specialist trainee versus graduating, where it's like the perfect window to have a kid and start a family, and all these sorts of questions. To people that have these questions, what would you sort of say in brief?
There's no perfect time to have children. It just happens when it happens. Also, it's no perfect time to find your life partner. You don't know when you're going to fall in love with someone. And because you spend so much time with your fellow medical students, I think there's a statistic floating around. It's like 20% of us marry each other.
I think it might be higher than that, actually.
I know at least 6 or 7 marriages that have come out of my year alone.
Yeah. I mean, there's a term that goes around in medical school called medcest.
Oh, yeah.
I mean, which is exactly what it sounds like.
So I think that just go with it. Just because you're on this 6-year training program doesn't mean that life stops. Life keeps going, and if you want to have a family, you have a family. If you want to get married, you get married.
And it won't necessarily derail you. The program can accommodate for it, and there are some exceptions, especially when you get later into training, which we will talk about in another episode in more depth. But generally speaking, especially earlier on, especially before you've committed into a training program, there is quite a bit of flexibility to do that, and it's not so bad.
We are advocating for better conditions, especially for medical mums, because if you took time off to have a baby, they'd make you make it up in your holidays, which we didn't think was that fair. But it's still doable, and it's still it's fine.
Okay, so then you started working.
Yes, so
Yep.
I took 1 quarter off, and I was going to go back in second quarter, which was February, and so our baby was Elijah, and he was 3 months old, and I drove through the front gates of the hospital, and I just burst into tears, and I can't do this. I can't leave my 3-month-old in daycare. And so I rang them up and said, I'm not starting.
So you took another quarter off?
I took the whole year
I
off.
took the whole year off.
Well, yeah, they were a bit annoyed at me.
Yeah.
Like cancelling
But
on the
they'll
day.
be annoyed at you for anything.
Yeah, they would be. And this
Yeah.
is the NRA, in the
Yeah.
Northern Regional Alliance. So, yeah, they said, oh, well, if you're not going to start now, then you'll have to start next year,
Yeah.
quarter 1. And I was like, okay, that's fine.
Yeah.
Yeah. I just think my family's more important right now.
Yeah.
So, yeah.
Okay. Interesting so far. And now we're going to get into another interesting part. Okay. Tell me about Chnnl.
Okay.
Tell me about where that came from, why that is, and what the current situation is.
Yeah, sure. Okay.
If you're only listening on the podcast, sorry to interrupt. You're wearing the Chnnl
Oh yes,
t-shirt.
I am wearing a Chnnl t-shirt.
Yeah.
Yep.
So
without the vowels,
without the
because
vowels.
we're cool like that.
I was hoping there'd be a deeper meaning, but
Well, there is, and I'll explain that.
Yep.
But the reason why we took the vowels out is because of the Google search. Because every time you typed in channel, it would come
yeah,
up with
true.
like TB3 or Sky,
Yeah.
and so yeah, we did that for the Google search. But yeah, so I was 4th year medical student. I was president of the New Zealand Medical Students Association. I was leading all these advocacy programs, and it was my first run on a surgical ward. I thought, yes, I'm a nurse. I'm finally going to be able to show them what I know. Watch out, kids. You might be smart, but I know how a ward works. But unfortunately, it wasn't the experience that I hoped it to be. I was put with a notorious surgeon who just decided that I was way too confident for him and that I needed to be shown my place. He would grill me in front of every patient. He would even say things about what I was wearing. It wasn't appropriate. And, it was totally professional clothes. There was nothing wrong with my clothes. Things like, my glasses. I was wearing glasses at the time and they were much too big for your face.
okay, that's unacceptable.
This is the same surgeon in theatre who would find some blunt pair of scissors, and instead of asking for new scissors, he would just throw them across the theatre room.
Yeah. That type of stuff happens, and it's unacceptable. And it's, I think thankfully it is. There's a lot less of it now, and I know that the colleges, when I say colleges, I mean training colleges for specialties, they are cracking down on this type of behavior a lot more, and so people are aware of it. But especially some of the older generation doctors have been notorious for it, but it's a lot less now, thankfully. But anyway.
Yeah. So here I was going on live 7 a.m. breakfast TV, and then walking into the ward.
I saw that. I watched that.
Being grilled, and then totally losing it. So here I was on one hand trying to put up this big facade of who I was, and then I was really struggling. I had bouts of anxiety. I was having panic attacks even thinking about walking onto the ward. Even going into the hospital, I'd start to have a panic attack. Wasn't sleeping. I started getting, signs of depression. And this was just a 6-week placement.
And I think it's so important to say that this is not an uncommon story. I mean, I know so many students that have had almost verbatim the same type of experience that you've had, especially women in medicine are much more likely to be bullied in the workplace and undermined. So for anyone who doesn't know yet, Liz, you really kind of led the anti-bullying campaign.
Well, after this, yes, that's the next bit of the
and
story.
that's where it leads to.
Yes,
okay.
it is. Yeah. So then I said, well, I can't do this anymore. I thought I wasn't good enough to be a doctor. I actually didn't recognise that it was bullying, and I just thought it was actually me. And I thought, oh my gosh, I'm not good enough.
I can totally understand how you could.
We have this
get to
imposter
that.
syndrome, right?
Exactly.
In medicine, we go, oh my gosh, I don't deserve to be here. There's been a mistake. They let me into med school. They're going to find out that I'm not real. This whole thing that goes on in our minds, I don't know why, but it's very common in research as well. So I went to the dean of the medical school and I sat down with him and I said, look, I'm just not cut out to be a doctor. I'm going to quit. And he laughs at me.
Yeah.
And he goes, you can't quit? I'm like, what do you mean? He's like, you're like amazing. You can't quit. And I'm like, oh, thanks. But no, I'm really not doing well. And I'm obviously failing surgery. And he goes, oh, yeah, you're failing surgery. So I said, oh, what should I do? And he goes, oh, I think you should toughen up.
That's always the first critical step, right?
Yeah, be more resilient. I now now hate that word resilient.
Yeah.
Because I'm like, you don't know how resilient I am. It took me 5 attempts to get into medical school.
Do more
I'm
yoga.
resilient.
There's a, yeah.
Yeah, and so he goes on, go see a counsellor. So I did one of those things, and I went to see the counsellor, and she's like, oh my gosh, that's bullying. And that's when it dawned on me for the first time that maybe it wasn't me. Maybe this guy actually had some behavioural problems. And so I was like, oh, okay, it's bullying. And then she gave me some tips on how to stand up to a bully, and I've got a whole story around that, which we don't have time for, but I managed to sit down with him and say, hey, this is how you make me feel. Yeah. Can you please help me? And he said, oh, you're not the first person to tell me that, you know, I make people feel that way. Yeah, and I was like, oh, phew. But yeah, that was a scary moment going and facing, you know, top surgeon.
Yeah.
So anyway, from that led to me speaking about my experience. So I was telling people, I was like, look, I actually experienced bullying, and this is the effect on my mental health, and this is what we want to do about it. And there was an avalanche. People would come up to me, like even like other senior medical doctors would come up to me and be like, you know, I was bullied when I was a junior, and, you know, it needs to stop. And this was before all the Royal College of Surgeons and all that, you know, what you talked about actually happened. And so I was like one of the first people raising the flag on it. And so it was quite scary, but I started speaking about my experience to the media. Got on the front page of the Herald, and it was really cool because a lot of the students actually gave us permission to use their stories to show what was really happening.
It just shows how much of a real movement there was about it.
Yeah, and so we did a survey of all the medical students in New Zealand, and we found that 54% had experienced bullying or sexual harassment whilst on placement in the past year. Yeah,
I was going to say 54%, honestly, for me sounds like an underreported. I suspect it would be, the real number would be higher than that.
And so once we started making a bit of a ruckus, I got in trouble again with the deans. What are you doing? Bringing our medical profession into disrepute. And then at the same time, the Royal College of Surgeons, they started their survey with their trainees, and they found the same. They found about 50% had been experienced bullying during their surgical training. And then the RDA, they did a similar one as well, which is the Resident Doctors Union. And so then there was like 3 pieces of evidence now leading towards that we have a problem. And yeah, thank goodness it was at the right time. #MeToo also kicked off just after that. So that was 2015, 2016. And yeah, there was just like a whole groundswell of change in society in general saying actually bullying is not okay in any profession.
And so that experience laid the foundation for what would become Chnnl. Is that sort of the segue?
Yeah, so that is. So then I started doing more and more research. So nobody was getting into this workplace mental health side of things, and especially with that bullying and sexual harassment, discrimination kind of side to it. There was a lot of OC health, but there wasn't really that whole getting into those really tricky issues like bullying. Yeah. So then I made it my mission to research that. And we had a research group in Otago called CAPL, Creating a Positive Learning Environment. And so we've published about 6 international publications now, trying to look at solutions.
Just in the last...
Just 4 years.
4 years.
Yeah, in the BMJ and and international conferences.
Wow.
Yeah.
That's very impressive.
Yeah.
Especially in such a short time period. Especially on top of everything else that we know that was going on.
And doing TI and being pregnant. And okay. It's great.
So tell me about Chnnl. What is it for the people that aren't familiar? You know, what is it about, and where are you seeing things going?
Absolutely. So part of the research the part that I did with the group was around focus groups. So we got people in like nurses, doctors, medical students, and said, what do you want to help with your mental health in the workplace? What do you want to start to tackle bullying and sexual harassment? And they said that they wanted an app. And I was like, no, you don't want an app.
Yeah.
There is an app out there for everything. And they said, no, we want an app. And I said, okay, tell me why. They want to be able to have an anonymous, safe channel to be able to voice what was going on for them. Yeah. You can't just like walk into the dean's office and say how things are going. You don't want to be labelled a troublemaker. Sometimes it's quite subtle. So you don't know whether you should report it or not, but it's still affecting things.
That's a good point.
The other thing is that they wanted to be able to do it 24/7. They wanted to be able to do it on the weekends when they had time to report things. They wanted to be able to give feedback when at 2 o'clock in the morning when you know you're awake at night and you can't sleep and you're actually like, actually that was a pretty shitty situation. I want to tell someone about it. and they wanted it to be anonymous. So if we had it, the medical school had developed one that was like on their portal, on like Moodle or whatever you guys have at Auckland Uni. And they said, well, people can walk past and they can see us typing, and it's logged to our username, so we could be traced. So they wanted something that was on their personal phone. Yeah. So I said, okay. So we developed the first app as another medical student who kindly did that, and we did the first trial at Otago, and people used it. And they loved it. And every day they would tell us what happened to them, positive things as well. Like, actually, my boss was amazing today. I actually learnt so much. And then other things like exam stress, or, someone said that they're Māori and they were mistaken for the cleaner, and things like that. It's things that they probably would never tell anyone else, but it's actually really important for the medical school to know that's happening. And so then we aggregated all that data, anonymised it, and then gave it to the medical school so that they can make changes. And so then everybody was like, that's amazing. And I presented it at the Royal College of Surgeons in Adelaide, and they were like, this is great. Can we have it in our hospital? And I was like, well, it's a research project.
Right, because at the time it wasn't a thing.
It wasn't a thing, right? No, it was still part of that Capel research group.
Yeah.
Okay. And so I was like, okay. And then I was actually taking that year off because I wasn't working in the hospital, right? Because I had Elijah. And I had an email from Middlemore Hospital, and they said, hey, can we have your app? And we've got some funding. We'll pay you for it. And I was like, oh,
that's perfect dialogue to have.
Maybe we can do something. Yeah. And so I went to Auckland University at that point to say, hey, can you help? They sent me to Auckland Uni Services. They put me on their commercialisation pathway, which I had no idea what that was, which basically means they turn you into a social enterprise, a business.
Yeah. And then that's you now.
That's it, yeah.
So, wow. Is the summary of that story. Yeah.
I think, even with the previous week with Art and Nick, it's kind of the same message that comes through to me, that it's one of the main things is sort of just like age is just a number, and in our heads or societally we have this kind of pathway that we're supposed to follow. Yeah. And it's like, this is the time that you're supposed to do this. And I don't know if you feel this way, Neil, but especially as like an Indian person, as well as like a Catholic Indian, where a lot of my friends are following that pathway. Like, you go to university, you get married, you find a house, you're like doing the job, you have the kid, it's just nice to see that time is just an illusion kind of thing.
Mum and dad are sort of like, get on with it.
Same thing with me, and I don't know if this happens in like Korean house. Your parents are a bit more chill.
My parents are more chill about that.
But certainly my parents to my brother, they're like, well, you're this old now, you should be doing this. And it's just nice to see that, in a way, for like at my age, it's nice to see that everything ends up being okay, that not everything is set in stone. You don't have to follow this specific pathway. Time is just an illusion, and you just, if you focus on doing what you love, and even if that evolves, it's okay. Kind of thing.
I think the favorite part just generally about the entire interview is just how unorthodox but still so effective her like pathway through medicine and before medicine really was. Not that she intended on like planning it that way or going about it with that way. How long did it take? 12 years in total then? A
long time. Actually, I even mentioned it in the end of that clip. I actually say like it was so unexpected how things played out, but it would have been the way that she would have wanted anyway. And that resonates with a lot of what people say. What you hear from these types of messages often is that you just chased your passion. Back when I was first starting Foster Our Future, I was in my 5th year of medical school, right? And then I spoke with one of the conference speakers who was at one of the Auckland conferences at the time. His name was Dr. Sharad Paul. He was very well acclaimed, widely known doctor and author and other things. And he, for whatever freaking reason, he decided to entertain me for a coffee because I asked him to.
And maybe that's whatever the reason.
No, but like,
is that not the reason?
But he actually accepted.
Give me a coffee.
This random, 5th year medical student saying, "Hey, I'm really interested. Can we talk? Can you talk about it a little bit more?" And he actually said that if there's something that you're passionate about, because my main issue was I'm passionate about multiple things. Where do I go? What am I meant to do? The medical community seems to say you need to be sort of one track, one fixed mind, pursue that. And then on the other hand, it's kind of well, I don't really want to. is that kind of wrong? And he just sort of said, just do what you're passionate about, and just do that, and don't let other people sort of dictate that or say what you can or can't do. Just do what you do, and just And I think really that question, when I was asking it at the time, I wanted there to be this answer: what is the path? What should I do?
Yeah.
The older I get, the more I sort of experience, I realize there isn't really that answer. The fact that you're looking for it already is kind of off the wrong foot. It's just do what you do, see where it goes, trust your ability to adapt and overcome and be flexy and things like that, and just go and see. And after this podcast, we had a webinar, right? We talked about a lot of these things as well, and especially the graduate part. And one of the people who had failed to get into medical school from their first year was watching that, and they said that was like the first time that they really thought, like, hey, graduate entry maybe is like really a serious thing, that like they'd never thought about it before that. And it's so common, right? Like you get a lot of these high schoolers coming in, they don't think about graduate entry, but really that is.
And they feel if they don't get in the first go, it's like they weren't meant to be a doctor in a way, or they feel like, oh, it probably just wasn't right for me, and they'll find something else to do. But it's like, you know what, if you're really passionate about it, there's going to be barriers, but it's like with anything, if you put your mind to it, you pursue it, it is your passion, you chase after it, you'll end up where you're supposed to be in a way.
And I think I can speak for the medical side of things, but you could probably agree for the physio side of things as well, that like a lot of these postgraduate students, and especially like super grad students, we call them super grads, they do so much better. They just have figured out so much more about themselves and their life. And I guess I don't want to use the word pathways given everything that we just spoke about, but they're a bit more comfortable with the uncertainty, and they're a bit more able to navigate through it, I feel, with at least less stress for no reason whatsoever. We tend to stress over every single thing that we can get our hands on, but they've just got like, that's just life. Like
so much
just
experience.
move on.
And even as an adult, they have so many other things going on in their life. Like they have children, as
a mortgage.
Yeah, they
What's
have
that?
they have all these other things, and it's like uni's just a side thing. Whereas I feel like at our age, it often, or people that we know as well, it often seems like it's just the main thing all the time, and that's just comes with experience as you grow older.
And she did the whole 10-year extension for the ETFS. Was it EFTS?
I can't remember.
I can't remember what it stands for, but it's just like the duration that student loan can be. And that's that reminded me of another thing, because some of my other super grad friends would be like particularly pissed when the lecturer didn't turn up for the lecture, and we're like, woo, like this is great, finally.
Take it for
we can just
granted.
get our head out and stuff, because these guys know what they're paying for, and they know that this is all going to come at some sort of cost and stuff. We don't have to pay for it right now. We've got a student loan; it all feels free. But they've already got lives. They're working and stuff.
Yeah.
And they really understand the weight of the decision that they're doing, and what the study actually means for them, which is why I think, at least for some part, they end up performing better just because they take it seriously.
They appreciate the learning more.
Yeah. It's not a degree. It's like a prerequisite to how they're going to live their life in the future. And we look at it in that light, it's like, wow. Like,
I think when you look at things not just like this, but when you look at the perspectives that people have when they're younger, even when you go all the way back to like childhood, and then you see how people change their perspective and look at the trends as they get older and older, there are like a few things that stand out. One of those things being that you're more comfortable with the uncertainty.
Yeah.
Well, hopefully you get more comfortable with the certainty. And you, I think, are very much less black and white about things. Because I was very black and white, I was very sort of like, it's like either this or it's like this, or it's this way or it's this way, and you almost, it has a sense of security associated with that. And I can think of so many people that are like that, and you can see that it's probably not going to get them where they want to go. Most of the life is going to be in that gray area, and you just have to be comfortable with that and not knowing the answer. And I think part of that also means, which is another thing I think I observe, is that it just becomes so much more about that process. And we've talked about this so many times, but it just becomes more and more about the process rather than the outcome, because you don't know what the outcome is going to be, because you're just in the gray area all the time. So you just kind of hope that the process is what you want it to be, and then you find enjoyment in the process. And so it just things become so flipped from how you used to think about things?
Let's like tease that apart a bit more. Like, why do we feel so that black and white binary decision making makes us feel so much more comfortable? Like, I think it's just because like you can see that if it's going to be this, then you can plan for that. You know, the consequence of that.
Is that
what's
what
going
you
to come afterwards? Is that what you think?
In a way, but I also think that it comes from not having a broader perspective, or I guess, yeah, in the sense wanting to have an outcome associated with something rather than just being like
that you can foresee.
Yeah, that you So basically, like you can plan ahead, but it's sort of like it gives you choices. It means that you know what's going to happen next, as opposed to, I guess, considering other options. You know what I mean? Like even going beyond thinking what's just in front of you. For me as well, like in my own experience, I try not to do that because in some ways it does kind of stress me out. Like
it's challenging.
I don't. It's a challenge. You don't like looking beyond what's in front of you because that means it gives you more things to think about. And instead of seeing that as an opportunity, I see that as just more things to do, which is something that I'm working on. So
yeah. I can't remember if I legit read this off somewhere reputable or if it was just secondhand knowledge about psychology from like some Huffington Post, whatever.
From your psychiatrist.
Or whatever. Yeah, from my psychiatrist. If you don't get that, please rewind a few episodes. Yeah. But I think part of it is because when you're young, you're sort of taught a black and white kind of way because you need that sense of stability when you're young and growing. And we know that, like we know that young children, they really need to have a high level of security and stability in their lives in order for them to thrive, because that becomes a foundation for them. And I think maybe sometimes that transition from that type of thinking to a more real type of thinking, maybe that doesn't really happen, or at least not formally, and therefore... And the other thing is also that, you know, idea of having a lot of options and being challenged about that. I would consider that I would have a pretty growth mindset. And we've talked about fixed versus growth mindset, I'm pretty sure.
Yeah.
And so, you know, as a quick recap, right, the fixed mindset sort of says the cards you're dealt with are the ones you stick with, and that's what you've got to work with. It's capacity based, whereas growth mindset is obviously growth based. And so you seek challenges as learning opportunities. So I would say that I've got a growth mindset, but I would still I still feel like an aversion to having too many options, because it just feels in a way almost like a cognitive resource waste. In a way, like it doesn't feel very, very efficient. Well, I don't want to use that word, but
no, but yeah.
Yeah. So I wonder about that. Maybe that is just a really deeply rooted evolutionary part of the way that we think. We crave that. But, you know, with all of these evolutionary things, I think it's about, we recognize that, and then we apply our conscious thought to try to overcome that and train our brain to think of other ways and navigate that. And in a way, like that's like what makes a successful adult, right? Is that they're able to consciously overcome primordial instincts.
I think looking retrospectively though, like you're only going to be as wise as you are currently. Just because you've only got, like, it seems like it's...
I heard Neil say the exact same thing yesterday at church.
And I felt like it ties in kind of, that's why I was laughing just before. But yeah, like you're only going to be as wise as you currently are, right? Because you've, like, the only bit of experience that you've got is the experience that you've got, like as profound as that sounds. It's not profound. It's literally just like from the time you were born up until now, all the experiences that you've had will dictate how you see things, and it's never going to be enough. It's never going to satisfy us to make decisions, you know, 5 to 10 years into the future. And so we're stuck in this like paradox, like how do we get that experience without actually having it? And like it's debilitating to the way, and to some extent, because you're not always going to keep on waiting for those 5 years to try and get that experience before you make some sort of decision that's dependent on having that extra 5 years worth of experience. I'm not sure if I explained that clearly, you know what I mean?
Like you can't wait forever and to make the decision.
Yeah, exactly. Because you're just going to be left
we talked about
cycle.
a similar thing with Art and Nick last time, right?
And like we said, to make it more clear as well, he said uncertainty is possibility in that way. And that was just like, when you look at it in that light, I'm just like, no, it's not. But like, it is. I think I've rationally accepted it in my head, but emotionally I haven't come to terms with that. If that makes sense.
Yeah. I personally been really working on for the last probably year and a half on trying to separate that, deciding whether a decision was good or bad based on the outcome that it came from, and deciding whether the decision was good or bad based on whether it was the right process at that time. because you could make all the right. There's actually a business case that's actually taught this way. It says like if you've got an air traffic controller, they did all these wrong, screwed up things, but the plane luckily was fine. Would you
judge that as a success?
Would you say that's a success and then give them a clap on the back and also say that it was a near miss, but they pulled through? And it was something the majority of business managers would say yes, that they would call that a success and they give them a pat on the back for it. But actually, it doesn't really make sense because that process is more likely to have resulted in failure, repeated again and again and again. So thinking about it from a consistency, process, lifelong point of view, like I don't want to be the person that makes a couple good decisions by luck. I want to be a person that statistically is more likely to make cumulative good decisions over time and just eventually rack up benefits, unless I'm really, really unlucky, in which case, well, I'm screwed anyway. Anyway, big topics as usual. And yeah, I don't have any other further sort of.
Just enjoy the journey.
I think I'm just going to be contemplating tonight.
Yeah, let's be contemplative. That can be the that can be the homework for you. In fact, interesting question for you to tell us about is where do you sit on that spectrum of making decisions and being, judging yourself on the decisions that you made based on the outcome versus kind of rationalizing it on the process. Hopefully that sort of made sense, but I think that is a topic that always ends up as a deep conversation. In my experience, everyone has such a personal experience of that. So put that out to you. What are your thoughts on that? Let us know if you're on YouTube. Let us know in the comments on Facebook, wherever it is. Send us a message. We'd love to hear more responses. And as usual, if you've got any feedback or suggestions on other topics that we should cover, we're always looking for new ideas or interesting guests to bring on. So in your hands. And of course, as usual, thanks for listening.
What's he going to come up with this time? Oh, just
like the subscribe button.
What?
And make sure to subscribe to the subscribe to the comments and comment your like. And yeah, we'll see you next time. See you later.
Thanks for tuning in to Subcut. If you guys have any suggestions for content, please make sure you send it through.
You can get in touch and follow us on Facebook, Instagram, and YouTube, or find us on our website at jttmed.com/subcut.
Subcut is a podcast brought to you by JTT. If you or anyone you know is interested in a career in medicine, make sure to get in touch and check us out at jttmed.com.